Hello friends, this is Dr. Prathmesh Jain from Marengo CIMS Hospital, and I am very glad to introduce you to a great personality in the field of shoulder arthroscopy, Professor Ofer Levy. He is one of the designer surgeons of shoulder arthroscopy instruments, very senior shoulder arthroscopy surgeon. He is one of the great users and proponents of the pitch patch, which is a synthetic augment which we do for the rotator cuff. He is the president of Israel Shoulder and Elbow Arthroscopy Society. So today we have done the first case of pitch patch in Gujarat in a corporate setup, and we will be asking Professor Levy about his feelings and his approach towards patients who are having shoulder pain, and how the newer advances like the pitch patch will affect the patient's satisfaction and overall results following shoulder arthroscopic surgeries. So, Professor Levy, how does this pitch patch thing benefit to the patient? So, when we use this pitch patch technology, how does the patients get the benefit? Because we have used it for the first time in Gujarat, and people are asking us that why we should do a pitch patch in our case. The patients are asking us. So how, from a patient's perspective, this is an innovative device which will help them?
Well, this is mainly to do with cases that before that you didn't have a good solution for them. I mean, these are patients with chronic tears, with very poor rotator cuff tissue, with massive rotator cuff tears that you can't really repair completely, or you can only repair under severe tension, and all these, in all these cases, this is actually augments your possibility to repair it and augment the tissue. We know I've been using this patch for since 2013, which is quite a long time, and we saw excellent results with restoration of good tissue within the patch and around the patch. So it's really, you get so-called new ligament or new tendon, which helps you even if you need to use it afterwards in cases that you do a reverse shoulder or something.
Can we tell our patients that if we do a pitch patch, the pain component after the surgery will be less?
The pain will be the same as in rotator cuff repair. There's I think not much difference. You can tell them that the chances of re-tear are much lower, and the chances of good outcome on the long term is much higher. And this is cases where you couldn't say that the cases that are prone to have more re-tears. I mean, these are the massive, the massive chronic tears, the massive irreparable cuff tears that you don't know whether to do it or not. In this case, it gives you another tool to save the natural shoulder and do a repair.
So, people ask us, what is this pitch patch? So, is it a augment or is it some synthetic ligament? What is it?
It's a synthetic patch, which actually has got good tensile strength and good strength, so you get some more strength as well. It's friendly for cells to grow into and repopulate it, and actually we could see that you get good fibrotic tissue, good tissue around the patch.
So you mean to say we have a mechanical advantage as well as we have a biological advantage?
Yes. I personally use it with injection of PRP.
Okay.
And that's actually to push a little bit more, to enhance a little bit more the biological component of it. It's got a good biological characteristics as on itself. It's hydrophilic, so it attracts the PRP into it, or as we did today, when you do the arthroscopic decompression, open the channels, you get this little rain of blood, and so this actually, we could see that it's really attached to the patch, which is very nice.
Sir, in your opinion, the patch is best used with an arthroscopic technique or a mini open technique? What is if a patient?
It was initially the patch was designed by my colleague Roger Hackney for use as open technique, and then he approached me and I worked on it to do it arthroscopically, and then we're using it arthroscopically. It depends on the surgeon's preference. I'm as an arthroscopic surgeon, I will do it arthroscopically. I feel much better do it arthroscopically. You can see better, I think, arthroscopically.
So in the present era, we can say that ideally the pitch patch implantation should be better than arthroscopically. In the present era,
I think so. I mean, if we look at your fellows, your younger fellows and all that, they know arthroscopy better than open.
Yes. So,
A lot of my fellows don't know to do open surgery. They know to do arthroscopically. So in this era, it's probably arthroscopically. But if someone who's more an open surgeon and he knows how to do it open, he can use it. That's not a problem.
So we can summarize that pitch patch is a synthetic augment with a biological additional properties. It is useful for augmentation of rotator cuff, and it will improve our results of shoulder surgeries, specifically the rotator cuff repairs. It is best done with arthroscopic techniques using the recent innovations like Dr. Ofer Levy uses it with his sixter. So he is a surgeon who has invented and designed the sixter device, and he uses it very nicely to fix the two ends with the sixter device. And what we need to do is we need to use two ends, tie the two ends with the sixters to the muscle, and then the lateral end we will use a knotless device to tie it back to the bone. So overall, we can bounce on that with this pitch patch. We can significantly improve the clinical results of the rotator cuff arthroscopic shoulder surgeries. Please get back to us if you have any more queries. Thanks a lot. Thanks a lot, Professor.
Thank you very much.
To
Thank
be
you
with
for
us.
having me.
It's our pleasure to have you here, sir.
Thank you. It was great.